My name is Kori Johnson. I'm a clinic director and occupational therapist with Ivy Rehab for kids, and I've been with Ivy for 5 years. Multidisciplinary care means that we are all family-centered, and the family is driving the car, and they're the expert on the child. Everyone else is the expert in their profession with physical therapy, occupational therapy, and speech therapy. And every interaction is approached with deep empathy and creating equity and giving the parent agency to be at the head of the table and driving the team's decision making. And every time we're working together to come up with a conclusion where if we don't know the answer, we work to find it together, and the family's never left in the dark. So collaboration between therapists can improve outcomes by improving the continuity of care and by modeling trust and accountability for the family. It also reinforces the respect of each profession and just expanding and ensuring equitable access to best practice and evidence-based care. I think that it also goes beyond the black and white thinking and finds balance in the gray area. And there's 3 pillars in evidence-based practice, and we always think of the robust research that guides our critical thinking and clinical reasoning. But a successful multidisciplinary team is also going to balance the patient values and the clinical expertise with honesty and integrity. In the most ideal scenarios, the parent is providing the expertise on their child and is helping drive the decision-making of the therapy team. Again, it looks very honest and open and sometimes even transparent and uncomfortable, and everyone's just working together to do what's best for the child. When everyone thinks of multidisciplinary care, we think of the formal roundtables or co-treatment or in-services that happen where it's not directly during the care of the child. But something I have found to be the most effective is having this felt safety to go to your team and say, I don't know if what I'm doing is working, or I think I'm finally getting somewhere with this. What can I do to keep this momentum? Or even saying, hey, I'm unsure about this, so can I get another set of eyes? And I think when you're vulnerable and really trust your team, that's where you start to see the most improvements in a child's plan of care. By keeping the family at the forefront of the care and remaining honest and transparent about the entire process and just making sure that the family is always involved. If it's not happening at every session, then at every plan of care update, there should be a conversation with where we are in the process and what we see next for everyone involved who is a part of the team. And sometimes these conversations will include asking the caregiver these 3 questions. The first one being, what is working for you? The second one being, what am I missing that you need me to do more of? And the third one is, where do you want to see us go from here? So Ivy Rehab for Kids sets itself apart by creating this individualized plan of care, relying on such a strong and steady team. The one thing that I love about Ivy Rehab for Kids is that I know therapists across the country who are wonderful at what they do and passionate about what they do. And it's unlike any other therapy setting where I'm going to know someone in Michigan or I'm going to know someone in Pennsylvania, and I can easily strike up a conversation with them and really create access to therapy on such a national scale. This is such a good question, but a tough one. What makes me most excited to go to work in the morning, and this will sound cliche, but it's really the families and it's the team and the culture. When you have a strong team of people who love what they do just as much as you do, it's a very easy decision to show up and go to work every day. And it's the same with the families. I've known families for 5 years, for as long as I've worked at Ivy. And it is just like a special, intimate type of relationship that you can't get anywhere else. And it's a different type of trust that you feel. And there is nothing more special than that when you connect with a family on a whole other level. That's what makes me most excited to go to work every day.